The ability to hear is such an ingrained part of our lives, so much so that many of us take our hearing health for granted. But if you talk to people who have experienced even mild hearing loss, you will learn that the ability to process sounds enables us to connect with others. Without hearing, we often feel left out. As we get older, changes in our hearing begin to occur. In the initial stages, we may have difficulty understanding words or start speaking in a louder voice. When this happens, it may be time for a hearing test. Here are some warning signs to consider a hearing exam. Do you ask people to repeat themselves, raise the volume of the television, regularly miss parts of conversations, experience a ringing sensation in your ear, speak loudly? Mindy Pollitt, a member of the hearing aid and audiology team at Lake Ear, Nose, Throat, and Facial Plastic Surgery, explains the different types of hearing loss.
There are 3 types of hearing loss. There's nerve damage, which is called sensory neural hearing loss, and that's just where the little hair cells in your inner ear or the nerve is damaged. So there's nothing that can be done to fix that. We can aid it with a hearing aid, but we can't fix it. There's conductive hearing loss, which is something medically is going on in the middle ear that's not letting the signal pass through to get to the hearing nerve. So sometimes that can be treated medically, whether it's fluid or infection, or even if the bones of the middle ear are not working, there's surgeries that can be done to fix that. And then the third type is called mixed loss, and it just means that it's a mix of both the nerve damage and the conductive. So there's a component of that loss that might be fixed medically, but you're still going to have some hearing loss from the nerve damage. We recommend people come in every 2 years for a hearing test. A hearing test consists of 3 components. There's air conduction, which is through headphones or ear insert headphones. Speech testing, where we have them repeat words back to us, and bone conduction, which actually stimulates the hearing nerve. So all 3 of those components are required by law so that we can tell what type of hearing loss you have. What we're finding is that younger people now need to come in for baseline hearing tests because we live in such a noisier environment that maybe our parents did. It used to be, 60, 65, but 50, if you're 50, 55 and you feel like you're starting to struggle, you should come in and let us test you so we can have a comparison. So if you feel like it's changed, we know what type of change there's been. A lot of times it's a family member that sends the patient in, but if the patient's honest with themselves, they'll notice that when they're in a group setting, they start to not include themselves in the conversations because they're not quite hearing everything and they don't want to be embarrassed by answering incorrectly. So they just kind of withdraw from the conversation. We always tell people, just stop and look at your surroundings. How often am I having to ask people to repeat themselves, or how often am I not hearing it so I don't answer? Those are kind of the signs that maybe you need to start getting a hearing test so we can see where you're at.
For more information on the hearing aid and audiology services available at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Hearing Things story link on our homepage, yourhometownhealth.com.